Good morning. This is Dr. Sandhu, and today I'm with Mr. Feliciano, who kindly has agreed to let us videotape his procedure. A year ago, we put in approximately 1,500 grafts. If you can just bend down and see that every single one of these is a graft that was implanted, because prior to the procedure he had nothing. And now, a question that patients often ask me is, what will 1,500 grafts look like? And this is precisely what they look like after a year. And obviously it's not going to cover and give an adequate cosmetic appearance, and that's why Mr. Feliciano is here today. And we're going to do a second procedure with the Neograft method, which is my treatment of choice for these patients. And we'll be able to demonstrate how easy it is to harvest again from the same donor site, and also to intersperse the existing grafts with new grafts to give him the density that he's looking for. Okay, we'll start the procedure. So here we are performing the Neograft procedure, and if you look here you can see at all the grafts that have been taken here. If you can just focus in on this and show. And the procedure is quite simple in that you isolate each graft, pass it through the suction site, and it suctions out the graft. And if you look closely, you can see we leave the hair here, so as it grows longer, the donor site will be untouched. And you can see this gentleman has already had 1,500 grafts taken out about a year ago, and in most patients you can go back and reharvest 3 to 4 times to get a total of 6,000 grafts if you so choose. So we've almost finished. We've gone from there to here to this side. There's a little bit more to be done on this side. So this is the harvesting process, which takes about 4 hours. And after that we'll take a break for lunch, and then we'll start the insertion process. Alright, so we have just completed the Neograft procedure, and if you pan over here and just, Renato, just put your head down, you can see all these additional implants, and these will grow in and fill out and increase the density to his scalp. Now, you'll also notice that I've done a lower lid blepharoplasty. And one of the advantages of coming to a board-certified plastic surgeon for Neograft and hair transplant is that it's not just male pattern baldness that makes patients look older, but wrinkles around the eyes. And if the patient is in the operating room suite, we can take care of wrinkles around the eyes and other minor procedures at the same time. Now, I also want to show the donor site. So, Ronaldo, I'm just going to ask you to twist around. So you can see this is the area where we shaved, and we've taken out a significant number of hair. So if I can ask you to come in and pan in, and you can see how close we have taken out each hair, each follicle. This is where the follicles have been extracted, and the hair will grow in. Now he'll come in a week to have the sutures removed from his eyes, and we'll be able to show you how rapidly the donor site heals up. Okay, all right, thank you. So today is 1 week after Mr. Feliciano had a 1,500 hair graft addition to his top. So if you can look over at the top, you can see all the grafts that we've placed in addition to the grafts that he had at his first procedure. So now he has a total of about 3,000 grafts. Now, as you can see, these are the little grafts that have been placed. They will shed, and in 3 weeks it will look as if nothing has been done. The hairs will go into shock, and at 3 months they will start to grow again. And then depending upon the density, if the patient is happy or wishes more density, he can have another 1,500 grafts. In fact, we could actually go back and do another 1,500 grafts today, because if you look at the donor site where we took the grafts from, it's ready to be harvested again. This is completely different from the strip method where you would have a large scar and where the patient would be just coming in for suture removal today. And the other thing, of course, is the benefit of coming to a real plastic surgeon is that you can have minor additional procedures. And Mr. Feliciano had a lower lid blepharoplasty, and this is what a patient typically looks like after 1 week. So when patients ask, what will I look like after 1 week? This is what you will look like after 1 week. And hopefully in 3 to 6 months, we'll get Mr. Feliciano back and we will be able to show you what the final result of these hair grafts looks like. Thank you.